Okay, good morning, everyone. Thank you for joining us. Our speaker today is Associate Professor Mark Davis from the School of Social Sciences at Monash University, and Mark will be speaking on the topic Digital Media and General Public Antimicrobial Stewardship. Associate Professor Mark Davis is Lead Investigator for Antimicrobial Resistance, Science, Communications and Public Engagement, AMR-SCAPES, an ARC discovery project on policy, communications and other efforts to reduce the impact of antibiotic resistance at Monash University. Thank you, Mark.
Thank you very much. Well, it's a pleasure to be here. Thank you for coming this morning on this rainy kind of morning. So as Arjun said, this is an aspect of an ARC that we're doing at Monash University around public. So people out there, not in hospitals, aged care or vets or anything, but the general public, and how they think and feel about antibiotics and AMR and what they think stewardship is. I've reported previously here on sort of news media representation, and we're busy analysing our qualitative interviews. 99 people spoke with us about their experiences in the community. So we're analysing that data, and we're busy interviewing general practitioners about their experiences as well. So there's a kind of three parts to this project. And this part, the part I want to talk about today is around digital media. And I've got an argument to make about why digital media is foregrounded when we start to think about general publics and antimicrobial stewardship. And I've got some preliminary perspectives from a scoping review that we've conducted to see what the literature is saying about what digital media can and can't do in terms of public engagement and stewardship.
It's usually the case. Yeah.
Oh, okay. So I'm going to talk about why digital media might be positioned, why we need to think about it, and then talk about the preliminary findings from the scoping review. So this is unpublished data. It's hot off the press, so to speak. So I'm interested to see what you make of it actually as well. Some examples from the scoping review, and then some reflections on what what the scoping review tells us about digital media in the future. So why digital media? So the interviews that we've done with general public show us pretty clearly that digital media are very important, very significant, often mentioned in relation to health information seeking in general, or antibiotics in particular. So outside of the medical consultation, Dr. Google is the next best kind of point of consultation. So that's alerting us to the fact that digital media are playing some role, and we need to find out what that is and be clearer about it. And when we did our content analysis of news media, so we looked at how the superbug story was being articulated in health news journalism, in media, print, television, so on here in Australia. We found that they do their best, but the commercial logic of journalism, and particularly the sort of data that journalists get almost on a daily, minute-by-minute basis about who's looking at their website, their web pages, where those people are from and how long they spend on that website, and then where they go from that website. That's really driving their thinking and writing about health issues. So I think we need to be aware of what's happening in the news media and that publics are kind of engaging there. But in terms of a sort of nuanced messaging about antimicrobial stewardship, I think we need to think elsewhere. So that's why I'm saying, let's think about what digital media can do in this kind of field. And this is a kind of example of the kind of headings you will see in the kind of web news journalism. Obviously, a kind of slightly scary, controversial story attracts more attention. It's the kind of clickbait effect happening in digital media. Another reason to go digital is this convergence idea. So the cultural studies people for quite some time have told us that actually, the old idea of the broadcast print or television media as kind of separate kind of channels of data, of information, of advice and public engagement is quickly disappearing. It's called convergence because all kinds of different forms of media are kind of, coming together in the one space. So we can find, for example, a Facebook site for ABC News. So not only do they have a web page and a television station and 24-hour news, there's also Facebook where you can go through and find videos from TV or listen to podcasts or pick up on stories. So, digital media seems to be where the action is. So it probably makes sense to start to think about it in terms of AMS. Some ideas, some information about digital media use. We're doing it a lot. So as a total population, I can't read the figures there, my eyesight's going. 68% or so of the population has up to 3 devices they use regularly to access, social media and news media. So digital media are prominent in Australian life, and that's another reason why we might want to think about that. And then when we looked at actually comparing print news and the online versions of printed news, we can see that there's a vast difference in how people are engaging. So let's take the Herald Sun. That's the most popular, unfortunately, the most popular printed newspaper in Victoria. And on an annual basis, 857,000 people acquire it and we assume read it. Maybe they just go straight to the racing pages. We don't know. But anyway, less than 1 million. Whereas we look at Herald Sun online, 2.5 million visitors in the same period. And if you go to news.com, which is the kind of Murdoch press thing, it's 5.5 million. So there seems to be a lot more activity online in terms of news. So it makes sense to start to put digital media into the kind of our calculations about how we should engage publics. It's hard to get figures about Australia. Note to self, this might be a good research project. 71% of US adults reported using the web for information, according to Pew Research Centre. And 45% of those searches pertain to prescription medications, within which we would include antibiotics. But I guess it was all sorts of things like asthma meds and so on. So not only are we very digital, news is dominated by digital media. Health is also a kind of main practice there. Health Direct in Australia talks about itself as a digital health strategy, and this kind of approach to engaging publics in a more general way is kind of gathering force. It's a stronger kind of theme in health and medicine. So much so that the Royal College has actually published advice for general practitioners about how to use social media in their practices. So everything, we're all going digital. And if we start to look at the kind of research and intervention activity that's digital media linked, that's not even about antibiotics, we can see there's quite a lot of new horizons happening here. So people are busily looking at what we do online as a predictor of epidemic behaviour. So Flu Trends was the famous Google web source that mapped searches for pandemic influenza and linked that back to clinical data about what was happening. And they made an argument for a while, which has been discredited, that our activity online was an early indicator of what was actually happening in the population. And I'll show you an example later of research that kind of looks at news about gonorrhea, drug-resistant gonorrhea, and behaviour in the general population. Online counselling for young adults is going online. People with cystic fibrosis are being given apps to record their symptoms and track their treatment. People with obesity and overweight, in fact, any of us who want to manage our weight, hello, can. Using nudging and tracking apps. Some of those are kind of clinical, some of those are just, commercial, the kind of tracking technologies. Psychology is moving online, psychology and psychiatry, thinking about cognitive and behavioural interventions, particularly because they're so procedural. They're kind of amenable to the kind of the logic of the web. Increasingly, in prescribing in both hospitals and in general practice, clinical apps and tools that support prescribing are being rolled out, and the list goes on and on. So there's a lot of activity going on there, and we've looked at everything that's related to antibiotics and antimicrobial stewardship, and that's what I want to talk about today. The other thing we need to think about, thinking sort of social science about this field, is that digital media has complexities and opportunities that we haven't had before in the kind of just traditional media. So my two images there aren't just for fun, and one of them is not just a doodle that I came up with, last night. The kind of old mid-20th century notion of a mass population engaging with a single message, at the film, at the movie theatre, television, or their favourite newspaper or books. That old idea is less tenable in the current kind of complex ways in which digital media operate. So the graphic underneath is actually a scientific representation of Twitter retweet networks from one of the papers that I'm talking about today. And that points to the kind of complexities of interactions, the multiple populations, the multiple two-way, three-way, complexities of how people are interacting through digital media. How do we engage with that? It's kind of simple to think, oh, well, we create a film about TB, in the 1930s, to encourage everyone to have their chest x-rayed, and they go to the cinema and they see that movie and they're mobilised to go and take up the, to have their chest x-rayed and see the doctor and hopefully be treated. Now we need to think about the complexity. So the old ideas of communication as the kind of simple process of sender-receiver, that really has been the bread and butter of health promotion and health education, we really need to rethink. And the point why I'm making this point is that actually, when we look at the kind of existing contemporary literature, they're not fully engaging with this complexity. They're still kind of tied into old ideas of communication is simply a transmission of one message out and we're receiving it. Another issue, and I guess we're all kind of across this, but I was fascinated to find the anti-vaxxer Facebook site. I hope they're not going to start watching me, but so yeah, look, there are other messages out there that are equally sort of amenable to access. So this one's kind of taking up all the kind of dangers and threats of vaccination and quasi-scientific discourse being deployed here. I'm really interested to see that Facebook has at the very top a kind of note to say that Facebook doesn't agree with what you're about to read in this Facebook site. So I think there, you know, Facebook and other social media are kind of facing challenges around, you know, truth, reliability, etc., and so forth. So, you know, digital media means the quality and reliability is something we need to engage with. You know, people choosing their ways of being in a more exaggerated way because they can, you know, like and block whoever and whatever messages they like. The journalism thing that I talked about before, that the people who are producing online material are responding to data they get almost immediately about how popular they are. This all brings us to issues of trust. Who can we trust? What are the criteria of trust and reliability? How do publics, how do we navigate this? How do publics who don't know much about antibiotics and antimicrobial resistance, what do they, you know, how do they engage with this situation? And what kind of knowledge, skills, abilities, what I'm calling digital capital, do they bring into that kind of exploration of digital media? All of these things are kind of thrown up as challenges for thinking about digital media. So coming back to our topic, antimicrobial stewardship, but this is general publics, this is not hospitals or aged care, this is people out there. I wanted to know, in the context of what I've just said, what has been done and with whom? Can we map the kind of current state of play around the importance, significance, the role of digital media in AMS? And then looking more closely at this material, what assumptions are made about individuals? What kind of theory do they have about behaviour, change, communication? You know, what do they think? What do people out there think they're doing with digital media? Is there any evidence for effectiveness? And what are the challenges there about proving that digital media might work? You know, can we find examples of interventions that use digital media that are effective, that we should probably invest in? What's the social and cultural fit? You know, how diverse is this media? Thinking about trust and cultural capital, how you know, how are digital media interventions reaching out to kind of social diversity? And to what extent do these interventions embrace the complexities and challenges that I've started to outline in the digital media environment? So taking up the kind of, this is not a systematic review. I've got no, you know, statistics for you at all. It's a scoping review, and it's following the Peters kind of methods, very simple, but well thought of kind of process for being systematic about what the literature is telling us. So at least there's a line in the sand that we can start making an argument about. So 4 questions. How are digital media linked with antimicrobial stewardship amongst the general public? Note that I'm saying linked because I'm interested to keep in there research that's looking at that relationship without it being an intervention. So I'm interested in interventions, but also a range of kind of activity. How are digital media playing in antimicrobial stewardship in a kind of broader sense? What AMS messages are actually being conveyed in digital media? And I think this is pretty important. What theories and assumptions are talked about in this literature about how to shape digital media interventions, and what evidence is there for effectiveness? So, as I said, this is a kind of preliminary take on the field. So this is not published yet, and I'm interested to know what you make of what we're finding here. So we looked for everything antibiotic or antimicrobial in the kind of common websites, databases, Medline and base PsycInfo, and then to pick up social science and arts and humanities in Web of Science. And then we kind of searched antibiotic or antimicrobial, quite broad, kind of inclusive, 50,000 citations would come up in the last 10 years around antibiotic and antimicrobial. And then looking at different signifiers for the focus of this study. So, campaign, digital media, Twitter, Google, YouTube, and so on. And forum actually turned up as something that was kind of useful. And you'll see in the pattern of just the raw figures here that, the medical publishing is much more active. It's not surprising. Very little activity actually over in the social sciences and arts and humanities. I guess it's my job to fix that since I'm in the social sciences. So quite a lot pulling up through the medical publishing, a lot from just campaign. There's a kind of problem here because campaign could be anything. Similarly, Google turns up quite a lot. Whereas digital media, which is, I think, the real way of talking about this field, is hardly mentioned across the field. I'm always ahead of my game, obviously. Social media, mass media, social network, and then to some extent Twitter and Facebook pulling up the kind of right material. But that gave us 5,500 or so things to look at. And then we had to we can't review all of those. So we have something called the inclusion criteria. So we decided that we would look at human use of antibiotics outside the hospital. If anyone's interested in digital media inside the hospital, I've got those searches. Digital media only, specifically, or in combination with other methods. And I'll talk about that in a minute. And any description or evaluation or review, some systematic reviews of how AMS behaviour or interventions are kind of examined, talked about, and so on. So it's a pretty inclusive kind of criteria. It's not like a systematic review. And thinking about how the paper is providing new insight in relation to how to change general public stewardship. So awareness, knowledge, behaviours and so on. All very important. So this is the kind of PRISMA process. And I've just finished doing this, and if I have to read another article about digital media and antimicrobial stewardship, yes, anyway. And it's interesting, you find people who kind of repeat articles. It's interesting when you look very closely at the literature. Anyway, so we took out the duplicates and then we screened for eligibility, and you notice the dramatic plummet in numbers. So from 3.5 possible, some reference to media and antibiotics, when we get down to hard tax, there's only about 200, okay, that really address the themes we're talking about. And then we look even more closely, we see that these articles actually don't talk about digital media at all, or they're actually just surveys of knowledge in the general population. So that meant there were 30 articles that we could kind of look at that speak to my interest in what digital media does in relation to AMS. So a range of articles, a range of kind of themes. As I said, it's very inclusive. So there's about 6 systematic reviews over the 10-year period. The other good thing about this process is you see how this material talks to each other. You really do get a grip on what's going on in the field. There's quite a lot of research about Twitter. So this is looking at how Twitter can influence publics, and then more generally about how publics are talking about things like antibiotics and infection in Twitter. There's a few studies and a kind of emerging literature using methods to look at how what happens in the media might change people's health-seeking behaviour, like on Google or presenting at clinics. There's a few kind of very generic pieces on social media, just a kind of generic assessment of what digital media could do. Quite a lot on, sorry about that, it'll teach me for doing it late at night, Antibiotic Guardian reviews, the UK kind of initiative. Quite a bit about particular national campaigns, so principally before and after surveys of populations, and then saying something about what a national campaign does. And in that respect, each of these articles is talking about how digital media, or mentions digital media in that process. I've got a paper on online pharmacy. So like I said, I think it's important to keep in, to really have a picture of what's happening digitally around AMS. Let's keep in research that's exploring what consumers are doing out there in cyberland around antibiotics. And then some interesting material on online fora. So this is spaces where publics are actually kind of interacting and creating threads, asking questions, making comments in and around antibiotics and their treatment and so on. So this might seem like a bit of a jumble. So I thought, well, regionally, quite a lot of this material has kind of got an international flavour because it's looking at social media, which doesn't really have a boundedness. But then we can see that the UK is a dominant player around stewardship, and that's principally because of Antibiotic Guardian. Gulf states, Hong Kong, and so on, kind of playing as well. 6 systematic reviews, 17 quantitative studies, which are primary research, 5 qualitative studies, which is pretty good, I think, given the status of the field. 1 study that claimed that they were doing both. Always a difficult claim, but that's what they said. And then 1 program description. It's not really an evaluation, but just saying this is what we did. So I was thinking, in terms of my 4 questions, how do I, using these 4 questions as kind of lens, how do I kind of examine this? How do we examine this kind of literature? So how are digital media linked with AMS in the general public? I'm trying to sort of think in an integrative way to map what's going on. And maybe there are other dimensions that I haven't fully encountered in my analysis. But it seemed to me a very simple way of putting things together was to think about the specificity of the digital media and how variable that is. It's not like it's categorical, but there are examples of digital media which are quite specific and contained, and we have quite a lot of information about them. And then there are general public AMS campaigns that mash up everything: posters, television, online games, Twitter, etc. So how do we kind of conceptualize that? And then there seems to be a theme where what's going on online is sponsored by interventionists, so the National Prescribing Service or Health Protection England and Antibiotic Guardian. So these are kind of institutional initiatives put out for general consumption, through to things that actually, and I suppose the online pharmacy is the most clearest example of something that's led by consumers, and a market is being created because there's an interest amongst consumers for this, for these services. So I'm trying to keep this kind of map together to give us a way of conceptualizing the field, and maybe it gives us an agenda about how to think about digital media. So what I'm going to do is look at multiple media intervention-led, multiple media consumer-led, intervention-led, specific consumer. So think about these 4 quadrants and the evidence base that we have in each of those. So thinking, excuse me, multiple media, and intervention-led. So this is the national campaigns around antimicrobial stewardship. And it's clear that digital media are playing here strongly and becoming more important as time moves on. So the systematic reviews and the kind of evaluations from national campaigns are really showing that up. And all manner of digital media are being used: websites, webinars, pledging, messaging, online games, YouTube, Twitter, Facebook, and whatever the next kind of iteration of digital media will be, no doubt will be playing there. However, what people think digital media is not that precise. So some people would just call it mass media and then say, I only use Facebook. Well, that's not quite right, I think, given how Facebook operates. Is it the same as the kind of 7:30 broadcast on ABC? Some people use social media, some people, very few use digital media, and so on. So there's a kind of issue about digital media is not really coming to the frame of analysis as a kind of specific way of doing campaigns. So maybe a more precise definition, a working definition of what we actually think we're doing with this digital media and how we could better use them in the context of our multimedia campaigns. I think what really happens is that the social marketers have a range of tools that they use to get a message out. And so in a sense, national campaigns are black boxed. You know, there's a practical expertise that decides about the mix of media. Do we need to get in there and think a little bit more closely about which digital media is being used for what purposes and how? Be more kind of evidence-based about that. So thinking multiple media and consumer-led, so an example that I came across, and there's an emerging literature here. So people using Google Trends data over time, clinical data, things they can easily quantify, testing rates, and Smolachuk et al. Looked at the news about resistant gonorrhea and identified a period of time when that was happening, and then went and looked at Google search data, who was presenting, how many people were presenting at clinics for what reason, and testing. And they make an argument that actually the kind of this media health, drug resistance event sponsored activity amongst public. So I guess that's telling us that, you know, further inquiry, further knowledge needs to be gained about how these health events can actually change behaviours and influence consumers. So specific media and intervention-led. So this is not the national campaigns, although, you know, these strategies do speak to the national campaigns. And the classic one is the Antibiotic Guardian .com and all the Twitter handles and hashtagging. So people have examined hashtag for antibiotics and antibioticguardian.com. And give us some descriptive information. I do have some statistics. I've got a percentage here. I'm very pleased. So pledges, so this is the kind of Health Protection England have actually evaluated their campaign. Pledges are predominantly amongst healthcare practitioners, up to 69% over the period. The people who are pledging are you and me. And only 23% of people are nominating themselves as general publics. And another interesting figure here is that 61% are women. I don't know whether that means that because of the predominance of healthcare workers, that's happening, or whether there's some gendering of what men's business is in terms of health also playing here. And this is the kind of social texture that we need to start thinking about, I think, if we're going to make these strategies work better. Anderson looked at the top 10 hashtags, and looked at the Twitter sphere in different kinds of ways. And various people are showing that the most influential tweeters are really us, health agencies and news organisations, and that retweeting is somewhat circumscribed, and also just a reflection of the kind of health agency networks. I've also come across, so I approached antibioticguardian.com because I found they had an Australian site. So there are Aussie pledges along with British pledges. In fact, they've gone global. There's kind of 11 languages now you can pledge. So I figured, well, I'd like to have that data. They've only been going for less than 12 months. And apparently the Australian site is sponsored by Agriculture Victoria. Did we know that?
Yes.
Okay, I didn't. And it's less than 12 months old. And the NPS has another pledge site as well. So it's interesting that there's a proliferation of pledging going on. Should we be encouraging more participation in these pledges and the AMRs, Twitter Sphere, or is it really just for us? You know, is it okay that these are kind of media just work to keep us together as a kind of industry? So specific media and consumer-led. So this is kind of outside of the gaze of national programs and of the kind of institutional framing of digital media. And there's some literature that's providing, making an argument that if we look at online fora around health issues and antibiotics, we get a better insight into what people are thinking about and what their issues and needs are. This is on the proviso, of course, that we don't really know what that population is. We can't, there are issues about influence when we look at that general public discourse online. So Guri looked at mumsnet.com, pregnant women, urinary tract infections and how they were talking about antibiotics. Someone else has gone to look at a forum for people with acne who are heavy antibiotics users and talking about how they think and feel about antibiotics. Someone's even looked at Instagram, so people doing before and after shots of their acne treatments and seeing what happens there. And then there's online pharmacies, which are, I don't know, maybe you guys know all this. It kind of blows my mind, really. So 45% of online pharmacies that British people can use don't require a prescription. That's not good, is it? Is that good? No. And 80% let consumers choose the specific antibiotics. Like, that's just great. Yeah, so that's a space that we need to watch. Now, what's happening in that kind of digital space? We need to kind of bring that into our thinking about what's going on out there. So an agenda here for us might be, well, we could do some research about this. Good PhD project. Are these means for reaching and influencing specific groups and moments in their health seeking? No, are consumers actually telling us what they want and need and where they're actually doing things? How could we serve them better in this environment? So, what other messages are being circulated out there? And I'm a little bit critical here, really. There's not a lot of precision. Most of these articles jump from AMR is a bad thing, we're not using antibiotics properly, and this is what the campaign did. So there's a step being missed about being clear about, maybe it's fair enough, maybe that AMS is well enough understood in clinical settings. We don't have to keep replaying our definition of it. But what is it we actually want publics to do? And are we being clear about, are we specifying that? Are we operationalizing that effectively? And then are we evaluating that message properly? So there's some fuzziness here, and that's partly because of the way the science proceeds, and partly because I'm not sure that we're actually that clear about what we think publics should do. One fairly good definition came from Price et al. So they actually said, this is our definition of stewardship: adhering, not taking or demanding, and safe disposal. The only other space I could find a prop, in language, in sort of English, definitions of what adults are supposed to do. So with antibiotic guardian, you can decide whether you're a health protection, health worker, an adult, or a student educator. And then depending on which category, then you decide if you're kind of, looking after pets or you're an adult. So I've picked the adult pledges, and each kind of drop down has a different kind of combination of pledges to make. And you choose your pledge, and that becomes your kind of rationale. So these are the adult pledges for English people. And you'll see this is the closest kind of representation of what we expect publics to do. The Australian version takes out the NHS. So it just kind of uses the same pledges for Australians and so on. So, if this is the line in the sand about what general public AMS is, why aren't we seeing that more clearly represented across the research field? Is there an agenda here that we need to think about? So I'm trying to think about why this definition of fuzziness around AMS for publics. It may be that very few people make a proper link between a national communication strategy and what they're evaluating. So there seems to be kind of the oversight program kind of notion needs some work. Maybe something around translation. So AMS is really, the overarching goal is reduced consumption and more precise prescription and not sharing. But how are we translating those epidemiological, clinical insights into things that work for people out there in the world? And I couldn't find anyone talking about how they came up with these pledges or messages or campaign themes. I understand that people do formative evaluations, but they're not published anywhere. I can't look at them. So it's not really clear where our messaging is coming from. Do they kind of reflect the worldview of experts rather than what publics think antibiotics are? So more specificity of what we want individuals to do and how we articulate those messages with assumptions about how to change behaviour and what digital media might be able to do in that terrain. Brings me to theories. So again, not a lot of strong activity here on actually specifying what psychologically or sociologically or in terms of communication theory, what the behaviour change, what the change assumptions are. So that's something that we can think about in the field. Behavioural theories are the most dominant and kind of variable. So health belief model, social learning, social cognition. Some talk about affect and emotion, fear-based messaging. The emphasis is therefore on knowledge and attitudes and beliefs of the individual rather than the relationships with other people. So remember I said that most, 60% of online pledges were women. Gender seems to play in how people are engaging with antimicrobial stewardship. How is that reflected in our messaging? Our messaging is kind of gender culture free when actually people aren't really like that. They're operating in social contexts. The emphasis with the behavioural theories is on reduced demand and precise use, but it doesn't actually offer the consumer very much. It's actually taking things away. People going online and trying to buy their antibiotics, apparently. They're kind of asking people to do less and have less is so out of step with how the logic of consumer culture, which is to offer something, to sell something, and people to acquire it. I've started to think about, safer antibiotic use as a kind of, perhaps that's a way of saying, this is the new and improved treatment for infections that we're offering you. Get the new and improved, more evidence-based approach to your healthcare. rather than saying you can't have your antibiotics. And as I was saying, this kind of individualised behavioural theory is kind of a bit asocial, a bit ahistorical, to kind of dictate people out of their social contexts. There's some interesting communication theories emerging, so people thinking about social influence and networks and memes. Anderson made reference to contagion theory, so how an idea is literally transmitted in a social network, and understanding that network is a way of theorising what we're doing with digital media. Groshek, Groshek talks about self-fulfilling knowledge bubbles. That's a kind of familiar trope of digital media. But also he explores fatalism, whether that becomes the kind of conceptual bubble for how knowledge is transmitted in digital media. So there are some interesting kind of perspectives emerging in the field. However, there's little reference to what I'm calling psychosocial theory, so an integrated kind of more sociological gaze on what's going on. Very little discussion of trust and how it could be promoted as a communication goal. You know, maybe the underlying thematic here is not so much what people do, but their relationship with their doctor, their prescriber, and the trust they invest in that moment of prescription. There's not much discussion about the fact that for the general population who aren't sick very much, an infection emerges in a particular psychological and social situation. So an earache in the child, a toothache, etc. These are not chronic identity-linked kind of behaviours. So they're harder to kind of influence. There's very little discussion of the kind of moral subtext and the risk management kind of perspectives that we see in other parts of health sociology being applied here. And little kind of discussion of how the individual, you know, what they can and can't do is actually constrained by the world we live in. You know, we're not all floating around as equivalent agents with 100% agency all the time. Work, gender, pregnancy, disability, illness, cultural capital are all kind of preconditioning how we engage. So it'd be great if we could think more about that in our kind of investigation of digital media. So more attention to social and cultural basis of antibiotics consumption. So evidence, there is some. It does seem on balance, it's worth doing, promoting knowledge and awareness. So Wu looked at, this is the National Prescribing Service evaluating what they're doing. So they looked at campaigns in Australia over time and simply looked at the PBS data for prescribing, and using the statistics, which I don't understand, they've found a relationship that dispensing is decreasing over the time that we've been doing campaigns. So we can infer that campaigns aren't making things worse. We can't make inferences about what the other factors are that might be influencing what's going on and around dispensing. It may have nothing to do with the campaigns. There's some evidence from the review that we did in the UK that interventions do work, particularly in controlled environments, the classroom setting, with parents of kids who are using antibiotics or with kids themselves. So highly structured pedagogical interventions before and after, knowledge and awareness tests, showing that there is some impact. Far less easy to justify that there is an effect with public campaigns. Cattle and Matamoros also make the point that there's very little evidence base from other languages. So there's a kind of English-speaking hegemony in the evidence base. Again, another interesting research project could be fashioned around that. So the reviews are showing that also that communications on their own, so out of context, without a national strategy, without a kind of robust theory and justification for what they're doing. And I'm also saying the clarity around the behaviours we want to change. It's unlikely we'll get large and enduring effects. The other thing that's clear is that we don't have much evidence about digital media per se, because it's bundled in with the campaigns. It's not kind of teased out. So maybe there's another agenda here. Maybe the next step might be to design an intervention and then test it. That would be a kind of great project to actually tease out what the benefits and losses are about using digital media in combination with other media. And also, I think that, although we're using digital media and having a go, red hot go, are we really using theory about what digital media do to kind of design our campaigns? So I'm asking that, do we need a more digitally aware, culturally specific approach to how digital media might play in this field? Particularly if they're going to become more important, which is highly likely. So, my reflections. So this is just my, I showed you an AMR-scape of digital media. Now I'm going to show you Mark's dreamscape of digital media, what I think, in an ideal world, it would be great. So, an evidence base that tells us how best to message for general publics in particular, that's based and seated in consumer consultation. Luckily, I'm doing research like that, so I might have something to say next year about that. And also insight into the specific contribution of digital media and how it might enhance and sustain evaluations. And a theory base. So, can we use psychosocial theory to think about how we do influence people outside the hospital and take on the kind of challenges of trust, responsibility, and that relationship with the GP. Culture and digitally specific perspectives. And I also think there's an agenda here for programming. So I think programs need to start thinking about the multiple links between digital media and general public AMS, how public participation might be increased in things like the pledging and Twitter, and how we would serve people who are seeking online, antibiotics online, off prescription. So this is my dreamscape. So my reflections are national campaigns with clear, consistent, positive action messages, enhanced understanding of the contribution of specific media, and culturally tailored approaches. For multiple media and consumer-led, increased knowledge about how media synergies are impacting on health-seeking behaviour and what that might say about our national strategy. For intervention-led, specific media, look at things like pledges and Twitter. How do we increase participation? Maybe we don't need to. Maybe that's not a space where publics are going to play. And then for online fora and pharmacy, address this phenomena in our national campaigns and think about the tools and resources that we could develop to increase AMS and reduce harm. Thank you very much. Is this water for me?
Yes. Just check, there might be a question online, but if, please go ahead.
Yeah.
It's just so fascinating. I'm having to put together a talk about sepsis and AMS, and it struck me is that the media approach to sepsis has been very successful, especially with the UK Sepsis Trust, where they've really personalised the problem. They've often there's examples of children who die from sepsis, and it's a massive lost opportunity actually, because there's a lovely little paper in BMJ that just published last month calling saying that sepsis and AMR is the flip side of the same coin, sepsis and AMS, because sepsis is also bad appropriate use of antibiotics actually. And so there's been an evaluation around that showing the media stuff around sepsis, whereas as you say, the AMR, I think there was a bit of a peak in 2015 when the EM report came out, some of the data did all that stuff and then it's dropped off again. And the sepsis stuff is going like that and the AMR stuff like that. And there's this disconnect with the media that I don't understand that the two are actually related. So I think that's something that we need to really think about.
I came across quite a lot of sepsis.
So you might need to talk about only because there's online things.
I did come across quite a lot of sepsis-related articles. It seems like a big field. I didn't really look at it. Maybe I should.
I think so.
Yeah.
Well, I think because I had a look at, I did the same thing. I had a look in PubMed actually. So I looked at the number of articles on sepsis in PubMed. Sepsis, and it's currently about 50,000. And then I put in sepsis and AMS, so sepsis and stewardship, and there are only 220. So 80.3% of all sepsis articles actually mentioned. But actually, it's a core part. So the UK AMR strategy and the Australian strategy will be bringing sepsis as a core component of the strategy. The UK strategy is excellent in how it's reporting sepsis because doing this sepsis pathway implementation work that I've been doing now, it is 10 times easier implementing a sepsis pathway from old hospital and trying to run a stewardship service. And it's because sepsis, I suppose partly because the figurative element of what it is, you can engage other people to help doing that process. So I think we should be smart about putting some of that literature into how we might approach the consumer.
So sorry, just Trent is very interested in your comments. Trent?
Yeah.
So I guess you could have you could repeat that for the online. But yeah, Trent is the head of Queensland AMS, and he's interested in evaluating the public-facing messages coming out of that particular service as well.
Cool.
So he wants to stay in touch.
I'll just, it's Nerman and the Queensland
Trent,
team are
Trent,
all on, and Nerman as well, I think.
No, he intended.
Oh,
never mind.
sorry.
He made a
Hi,
mistake.
Trent. No, I was just saying that the digital media approach to sepsis has been much smarter and that we should be harnessing some of the approaches. And I think they're inherently intertwined. And I think there's been this discordance with the digital media and media in how they've managed sepsis compared to how they're dealing with the issue of AMR. And I don't think AMS has a big focus in the digital media at all. And you know, I was interviewed by the Australian the other day, and I just said to her, you know, you really shouldn't be using superbug, you know, all that evidence. And she completely ignored me and went ahead and said, of course, it was a war on superbugs again. And I then sent her, followed up with the article, with the journalist, and I said to her, this is the evidence. There's lots of evidence you should be using. And also, I think you need to introduce a female voice into your articles because it was the same, it was Peter Collignon, and you know, it's the same two voices as the zombie thing. Anyway, she thanked me for the feedback. But yeah, I do, you know, like it's a bit frustrating, isn't it? Because you just can't get any traction.
Yeah, and I think we're investing resources and time into, we need to manage the news media, but we can't expect them to deliver. Ask the question.
I think another key concept for the coordinated approaches, including animals in with the humans instead of, it seems that a lot of the public education from human medicine is blaming the vets and the agriculture. And I think it really needs to be that AMR affects everyone, every species, and this is what it means for you and your pet and the use of drugs rather than a bit of a blame game. And as well as it's the same
Yeah, I totally agree. And so there's not a lot in the articles I've uncovered. In fact, in the 5,000, very little discourse on one health. And I think that's a reflection of where we're at in the field.
Yeah, and again, I guess the voices, some of the same old voices that are quite happy to. Hi, I think we've talked through 9:30. Sorry, we just did really loud for you squeezing in there.
All right. Thank you, everyone. We've come to the end of our session and look forward to seeing you at the next one. Thank you so much, Mark, for your fantastic presentation.
Pleasure.